Isn't it obvious that preventive medicine will save money and that we should put more resources into preventing chronic disease with lifestyle rather than early detection and treating it? I mean, a report by economists argues that preventive medicine won't cut healthcare costs. So how can this be? What is their definition of prevention?
Yeah, well, that's the whole issue. See, when we're talking about preventive medicine, we're talking about preventing diseases from happening. And when you prevent diseases from happening, they don't occur. And lifestyle is your most important medicine. So it's diet, exercise, stress reduction, sleep, weigh what you should, and avoid toxic exposures.
Well, what's going on is that these economists are misdefining what prevention is.
Yeah, for a very good reason. I mean, their intention is to try and keep the business of medicine as it is, because a lot of money is made on testing that is looking for disease early detection rather than preventing it.
Well, for example, they say that early detection, which they call prevention, is immunizations for one thing.
That would be one
because
thing.
they say that they'll prevent people from
Okay.
getting sick from
Okay,
these
and logically
diseases
that
and-
makes sense. Okay, it may not be true, but that's logically it makes sense.
because we have other points of view about whether
Well, that's
vaccines are
it's
even
it's
helpful.
but it's debatable. Okay, so that's one thing.
Okay, then they also talk about medications.
Uh-huh.
Like they talk about statins and the bisphosphonates and aspirin and
Exactly. And they make a big case for doing something that's aggressive that makes them money. In fact, the pharmaceutical industry has gone as far as supporting research that suggests that the polypill, which has a beta blocker for hypertension, a statin to lower cholesterol, a diuretic to lower the volume that we have to lower blood pressure, and aspirin that should be taken by almost everybody. In fact, they'd like to put that in the water. And of course, that's nonsense, and that's not good prevention at all.
they even say sometimes that steroids are good for prevention.
Well, now they're getting a little bit aggressive.
And artificial sweeteners. And we know that artificial sweeteners can have a lot of toxic effects.
Well, there are a lot of things that are debatable, okay, that you could make a case for. But what we're talking about here is, what do we do to change the system so that we're not confusing early detection from prevention? If you've got something at stake here, which means you're making a drug, you're a pharmaceutical company, you make a drug, or you have a technology of some kind that you want to see go forward, you're going to support that. So there are people who are saying the mammograms are important and that colonoscopies are important and pap smears are. In certain settings they are, but when you look at the United States Preventive Services Task Force and what they say about it, it's very debatable. In fact, it's not going to save much money. So these people who have written this article are right. It's not going to save money that way, but that's not prevention.
Well, the other thing, they were talking about angioplasties too, because those are very costly. So,
Indeed.
but some of these tests are really overdone.
Oh, the angioplasties for sure. I mean,
And it seems like the people that they should be focusing on to be taking these tests are the people that are at a high risk.
exactly. So and that's not prevention either. Although you may be preventing complications, okay, of a particular disease that you have. So doing something like a coronary arteriogram, which is very expensive, and the procedures that follow it, very expensive. But when you look at the data on that, the data really doesn't support it.
They're overdone.
They're 97% of the time, if you don't have an acute coronary syndrome, meaning you're on the edge of having a heart attack, doing an angioplasty or doing stents doesn't save lives 97% of the time. So we live and learn, because our doctors are interested in saving lives, but until we have the research to back it, it's just an assumption.
Well, maybe we should talk a little bit about the difference between disease care and health care.
Yeah, that's a big one. When you're looking at disease care, you're spending $2.7 trillion a year. It's 18% of the gross national product. And that's the system we have today. But disease care is not the most effective way to do it. And who wants to get sick? So if you can shift the paradigm from disease care to health care, we're actually doing prevention and doing early detection when it's indicated. That's a better way to go.
Well, their approach is not affordable,
No, it's not.
but prevention is affordable.
Yeah, but it's not the best thing for their business. And they're interested in what their stockholders want, which is what? Return on investment.
Well, if you don't get sick, health care is less.
Healthcare is less, but if you happen to be the person that is making income from that mammogram or that colonoscopy or that acute coronary process that you're doing, you're not going to be very happy about your economics. And unfortunately, we don't live in a democracy anymore. We live in an economy. And so it's money that talks. Until we change that, we're going to be having arguments like this that really question something that's not questionable. Prevention saves money, makes people healthier, and it's the way to go.